In fact, maybe it leads me nicely into my next bucket, and this is really the most significant part, if I may, of this conversation, the medical learnings about the virus, the last 5 months. We spoke in May this year. So the last 5 months, what have you learned new about the virus? And the first one I really wanted to ask is, how are you managing asymptomatic cases?
So it's a challenge. The best way of doing that would be a very sophisticated and developed contact tracing program. So not me, but our city here is doing a really good job in being able to identify people who are infected and then going to their community, trying to ask who this person met in the last week and testing every single person. What New York City is also doing is, because New York City has one of the lowest rates, the New York State has one of the lowest rates of infection currently in the US. Any person traveling to New York State from anywhere else in the country is being asked to test twice, once on admission and once 4 days into admission. And that kind of contact tracing is what's helping in being able to keep the numbers down. That, of course, needs a lot of resources, both in testing and manpower. So not an easy thing to do, but that's one thing that is helping keeping our numbers down a lot. The other thing that we should recognize is that China, which was the origins of this, now has one of the lowest rates of infection in the whole world. And the way that they did it is very difficult to do in a democratic place like India, where they essentially locked people down physically in their houses and didn't quite matter whether they were alive or doing well or not, just to clamp down on the infection. They put people on forced lockdowns for months to come. And that is great in China, but impossible to do in India or US. So great testing would be the way to go. So if you, for example, if you have someone who's confirmed COVID in your family or in your friend situation, you might consider, especially if you have at-risk people at home, to get tested.
Okay, so I was going to ask you about contact tracing and whether it is at all possible and whether it needs to be taken seriously. You answered that question.